I wanted the whole wife and 2 kids and a house and car and all that sort of thing. It's just always been part of my plan. It's a great feeling to be a dad. It's the best thing in the world. You can't rate it to anything else really. It's one of the hardest things you ever do, but it's also the best thing you ever do. So it's so rewarding. When you see a little smile, it makes you feel so much better. It brightens up your day, gives you an excuse to go to work and come home and see him again. It's fantastic. I think close friends, possibly, I did say about it, ones you really trust. Otherwise, it's a bit of a sort of a no-go area really sometimes. I think as men anyway, you sort of don't really talk about that sort of thing anyway really. You talk about football, cars, anything else but relationships and feelings and things like that. So it's kind of normal in a sense, but it's hard to know that that's going on in the background. You've got to carry on your happy working day, sort of put on a facade, everything's all right when you know it's not, sort of thing. But it was disheartening because I found out about the issues that I had, and feeling that you couldn't give your wife, your partner, the thing that they most wanted in life was hard, and knowing that possible IVF and things like that was the only way forward. It's just hard really. You think you're the only one that's suffering, but there's loads of people. You're not the only one at all, and that's quite a big sort of help sort of thing. You think, oh, thank God, I'm not the only one. I'm not the only fish in the sea that's suffering. It's one of the things that's got to be done. It's a clinical procedure. Everyone's got a bit of a worry about it, but you just got to get on and do it, get over it, man up, sort of just try and do it really. I'll say the treatment really doesn't really affect the man. You just have to deal with, obviously it's a lot on the woman, so it is intrusive for them, but for us it's a sort of you have to be there for them because they have to go through so many injections, so many tests, up and down to the clinic, God knows how many times. It is hard, it is intrusive. The people at Bourn were fantastic. It's such like a homely atmosphere. You almost look forward, although you shouldn't, you look forward to going there because everyone's so friendly and chatty. It's not like a sort of clinic as such really. There's clinics but you don't see that. You just go and sit in a nice cosy room somewhere and things like that, have teas and coffees for free and chat to the nice nurses. They couldn't have been more better really. It's fantastic. And then when it came to like the actual operations, well, the procedures and things, even that's just in and out. Although you're in a clinical bed, there's nothing to be worried about whatsoever. They make you feel so at home. I couldn't ask for better. But yeah, when seeing that positive and then making sure, getting another one and getting another one and getting the expensive one and then you realise it and then you just, you got a positive, and then you just want to hope that sticks, hope it stays. But yeah, it was over the moon when you first see them 2 little lines and you keep it from memory, you take pictures and you show everyone. And, we chose Bourn Hall as well just because we knew that was like the home of IVF, and that's what we were happy with, that's what we wanted.